Thank you for joining us, everyone, on Chari Center Health Hour. I'm Deepak Chari. And today we're going to be talking about what is leaky gut and 5 tips to heal a leaky gut. We're joined by a special guest speaker today, Dr. Radha Tamarisa, who's a board-certified gastroenterologist from Houston, Texas, and is also an integrative medical doctor. So stay tuned. Welcome, everyone, to Chari Center Health Hour. I'm Deepak Chari. So if you're just joining us, today we're going to be talking about what is leaky gut and what are 5 tips to heal a leaky gut. And we'll be joined by our special guest today, Dr. Radha Tamarisa, who's a board-certified gastroenterologist from Houston, Texas, who also practices integrative medicine. But first, I'd like to introduce who we are. My name is Deepak Chari of the Chari Center of Health. I'm an engineer and certified biofeedback specialist. My sister, Dr. Chari, specializes in integrative medicine, and she's the director of the Chari Center of Health. And we've been in practice, believe it or not, for 21 years. Can't believe it. And my sisters work with people all over the US and all over the world with advanced, innovative technologies and protocols to create incredible results in their lives. And there's so many testimonials all across the board. So I'm going to introduce you to her shortly. We also have our free virtual community clinics every Saturday morning at 10 a.m. Pacific time. So we encourage you all to join them because we also have live Q&A. So by the way, to join that, all you have to do is text VClinic to 888-111. And we'll be mentioning that later in the presentation. You text VClinic to 888-111, and you'll get the registration link for our Saturday morning 10 a.m. Pacific time call. We encourage you to join because we go into deeper areas in that program there. So now I'd like to introduce Mama Chari, who's another key person of our Chari Center of Health. She keeps everything together and integrates everyone, and she's the mama for everyone, or the mother for everyone.
Namaste. Welcome to the Chari Center Health Hour. This is our second show. Today we have a very special guest with us, Dr. Radha Tamarisa. She is a gastroenterologist and she is going to talk about leaky gut, which is a very, very common and a serious problem. Dr. Tamarisa is a very brilliant, very caring, and very dedicated doctor. I am very proud to introduce to you all Dr. Radha Tamarisa because she is my very, very favorite granddaughter and I am very proud of her. And I know she is going to do a beautiful job with her presentation, and please enjoy her presentation. Thank you.
Thank you, Mama Chari, for that wonderful introduction. So now I'd like to introduce to you Dr. Chari, my sister, the medical director of the Chari Center of Health. So here she is, Dr. Chari.
Thank you all for joining us here today. And again, we are so excited to bring our very special guest speaker, Dr. Radha Tamarisa. She is a brilliant gastroenterologist, board certified in gastroenterology, and she's been in practice for 16 years. And I'm just going to give you a little bit about her background. But one thing I want to let you know is that for those of you who are in Houston, Texas, and the surrounding areas of Houston and Texas in general, you are so blessed because to find such a brilliant doctor who is so compassionate, she has such a beautiful heart, and who blends the best of both traditional allopathic medicine and also is the bridge to functional medicine or integrative medicine as well. And what functional integrative medicine is really getting to the root cause of why you may be having any underlying symptoms or medical conditions, addressing nutrition, detoxification, addressing the mind and emotions, as a holistic picture to really get to the root cause and incorporate natural remedies and traditional medication whenever is required, as well as doing therapeutic procedures as well. And I always, tell my patients that I talked to my patients about Dr. Tamarisa and said, if you can go to Houston, you know, since what their particular issue is, I said, you would be so blessed, because I said to find such a caliber doctor is so rare. And they said, oh my God, go all the way to Houston. So we're bringing Houston to all of you here today with Dr. Tamarisa, and we're going to give you all of her contact information. She's going to give a presentation today again, and if you're just joining us again, on what is leaky gut and 5 tips to heal a leaky gut. And then we're going to have a live question and answer session. And so, you know, please join us and ask your questions. She's going to answer them. And then we're going to give you her contact information. And so you can feel free to contact her and take avail of all of her incredible services. So again, just to give you a little bit about her background, Dr. Radha Tamarisa, again, is board certified in gastroenterology and has been in practice for 16 years. And her practice focuses on an integrative approach to gastrointestinal disorders. And we're going to be addressing one of those disorders, leaky gut, today. And she practices at Katie Integrative Gastroenterology in Houston, Texas. Her functional medicine training comes from the Institute of Functional Medicine, as well as the American Academy of Anti-Aging Medicine. So without further ado, we're very honored to welcome Dr. Radha Tamarisa.
Thank you, Dr. Chari and Deepak Chari, Mama Chari, for having me on today. I am so blessed to know you all and to be here with you. Really, it's such an exciting time for me. So I'm super excited about our talk today. I hope that you know, leaky gut is a really hot topic in gastroenterology and in medicine in general. And so I hope that we can give you some tips, a little bit of an understanding of what leaky gut is, because I think this term is used so commonly. I hope that after today, you have a good understanding of what it is and what we can do about it, because that's really what's most exciting for us to be talking about.
Absolutely, absolutely. Well, Dr. Tamarisa, take it away.
All right. So just a little bit about myself. You know, I was trained in allopathic medicine, did my training at University of Texas in Galveston, and I settled down in Houston to serve my community. And I've been so blessed to have a wonderful practice and a wonderful community to serve. I became really interested in functional medicine probably somewhere about 6 years ago. And, you know, after practicing allopathic medicine, I realized that there was something more that I could offer my patients. And I really needed to be talking about nutrition and lifestyle in order to have a really good impact on my patients' health. And, you know, there's a point where you get tired of writing prescriptions that just don't work. And you really need to be diving into the patient as a whole and looking at nutrition and lifestyle and sleep habits and stress really are so important and crucial to intestinal health that really can't do justice without looking at all of that. And that's really where my interest in functional medicine came about. And over the course of the last several years that I've been incorporating functional medicine, I've seen a significant impact and a significant improvement in my ability to treat my patients. And there's a growing appreciation for treating the patient as a whole. People are not looking for prescriptions anymore. They really want an alternative approach and something more than just what allopathic medicine can offer. So I'm so happy and so blessed to really have this modality of treatment available to me. So let's talk a little bit about what leaky gut is. So I hope that in the next hour or so, we'll talk a little bit about what leaky gut is, why does it happen, and what can we do about it, because we really can repair this process and heal ourselves. As we know from Hippocrates, all disease begins in the gut, and that's why this topic is such an important thing to talk about today. So in order to understand what leaky gut is, we need to understand all the roles of the intestines. What does the gut do, and why is it so important? The gut has an incredible burden of being the first line of defense. When our immune system has such a fine role in being able to identify things that are harmful to us, and nutrients, being able to absorb the nutrients that we really need. And, you know, there are enzymes that are important in the intestines to be able to process our foods. We need bile to be flowing properly in order to digest, break down, absorb. We have vitamin absorption that occurs in the intestines. The intestines play a role in balancing our hormones and in being able to, again, identify things that are good that are coming through our intestines, but also being able to identify factors that may be harmful to the intestines so that we can react appropriately and eliminate those toxic items from our intestines. And the key player in all of this really is the gut microbiome. And there's so much research being done on the gut microbiome and its importance in regulating all of these functions in our intestines. So as we'll see, when the intestines are damaged and not capable of performing their function, the microbiome really plays a huge role in how we can respond and recover from these processes. So let's talk a little bit about gut permeability, or what we call leaky gut. So gut permeability is, you know, the intestines have the mucosa layer, the top layer of the intestines, and the cells in the intestines are designed to really have a very tight relationship. And so there are proteins that link cells together called zonulin. When there's something that irritates the intestines, the cells start to create some permeability. The zonulin proteins get disrupted, and the cells start to spread apart a little bit, as you can see there. And as the cells develop these gaps between them, the nutrients and bacteria and all the things that are entering the intestinal lumen, or the inside of our intestines, start to go across into the bloodstream. And that's when you get activation of the immune system. And this overreaction, this reaction of the immune system that goes above and beyond and is now unable to identify what is good and what is bad, it mounts this inflammatory response, and this inflammation creates more gaps between these cells. And as this process continues, you start to disrupt the gut barrier and the functions of the intestines, so that we can no longer identify good versus bad. Now that the reaction is a cascade, and we start to really continue to attack the lining of the intestines and become more and more permeable. And as you can see, as the intestines become more permeable, we start to develop reactions to foods that we shouldn't be reacting to. We start to get compromise of the immune system. And these manifestations can be very variable, as we'll talk about down in future slides. We also start to affect nutrient absorption. So this is when we start to see malnutrition and vitamin deficiencies. And all of this can manifest in autoimmune diseases. And we're seeing quite a bit more autoimmune disease than we've seen in the past. And a lot of it has to do with disruption of the microbiome, the bacteria in the gut, and disruption of the lining of the intestines, where we start to get this increased permeability. And then we see it in various forms. So leaky gut, or intestinal permeability, really is a manifestation of a deeper issue, something that really goes beyond just the GI tract, and it's manifesting in a lot of other organs. So let's look at what our triggers may be. And the triggers can be really variable. So poor dietary choices. When we're eating the wrong things, we're eating a lot of processed foods, we're eating a lot of sugars, sodas. I mean, all of these things can really have an effect on our intestinal cells. We don't value the importance of stress and emotion. So I'm often asked by patients, could this all be stress? And maybe 10 or 15 years ago, I would have said, no, this isn't just stress. There's just more to it than that. But stress has a huge impact on our intestines. And the connection between the brain and the gut is so important, and something that really needs to be appreciated and thought about. And this is why when we treat patients, we can't just treat symptoms. We have to look at what is causing these symptoms, and stress really has a big role in that. Infections, so bacteria that enter our system, parasites, yeast overgrowth. So this is a huge, again, item that we recognize more and more now. Yeast overgrowth can really create a lot of problems in the intestines. Toxic exposures, and this can come in the form of environmental toxins. It can come in the form of yeast exposure or mold exposure, and also chemicals, including the pesticides that are sprayed on our foods. These can be dental fillings in our mouth that have metals that we're being exposed to. And then systemic diseases such as diabetes, for example, which can play a role in the microbiome of the gut and really allowing for proper bacteria in our intestines. Low stomach acid, and this is such an important thing now because we continually use acid-suppressing medications in the form of proton pump inhibitors, which really have been used widely and really overused. And the more we use these medicines, the more we suppress our innate ability to produce stomach acid and to be able to regulate the kinds of bacteria that we can neutralize with these stomach acids. The more of infections we see, the more gut disruption we see, the more increased permeability and leaky gut issues that come up. Chronic antibiotics and steroids. Antibiotics and steroids are so commonly used now. We almost, at the drop of any hint of an infection, will prescribe antibiotics. And really, it's important to be able to differentiate when they're absolutely necessary and when they're appropriate to use and when they're not appropriate to use. And this recognition really is something, again, that has come to me in the last many years and has become an important part of my evaluation of the patient. And so what happens when all of these things affect our intestines and create this leakiness? How does it manifest? We can see it again as food intolerances. And oftentimes I hear from patients that they virtually react to everything. They were now reacting to vegetables, they're reacting to fruit, they're reacting to nuts, the dairy. Everything becomes problematic when a leaky gut occurs. And vitamin malabsorption. So when we're looking at vitamin panels or nutrient panels, we start to see that there are multiple vitamin deficiencies. These patients may be deficient in vitamin D, vitamin C deficiencies, and then other micronutrients such as zinc and selenium, copper, all very important nutrients for our bodies. And as I alluded to before, as you start to disrupt the intestinal barrier, you start to change the bacteria in our intestines. So the bacteria in our intestines play a crucial role in regulation of our immune system. And when we start to change the types of bacteria that populate our intestines, we start to create other diseases and other disease processes, including autoimmune conditions. Toxic overload, as we mentioned earlier, and as we get exposed to toxins and we get intestinal disruption, we start to get more permeability to these toxins that are entering our system, and they start to cross over into our circulation and create and mount more of an immune response. So, you know, the sum of this is that the elevated toxic load and the antigens, or the foreign molecules that are entering our system, become a burden on our immune system, and we start to get these systemic diseases and autoimmune conditions that we'll talk about next. So, you know, leaky gut, although it's occurring primarily in the intestines, it's affecting all of the organs in our body. It's affecting so many different systems. So when we look at the sinuses and the mouth, you know, we start to see people with frequent colds, as I mentioned, various food sensitivities. And we now recognize that leaky gut can cause leaky brain, and that manifests as depression, anxiety, ADHD, autism, even migraines, headaches. And so we need to, when we see patients with these variety of cognitive or brain-related symptoms, we need to be thinking about the gut, and is there an issue with increased intestinal permeability? We can see manifestations in the skin, acne, rosacea, eczema, psoriasis, to name a few. We also can see a profound effect in the thyroid, and Hashimoto's thyroiditis is one that we recognize increasingly as being a manifestation of leaky gut. Hypothyroidism, and Graves', which is actually a hyperfunctioning or overfunctioning thyroid, which gives another variety of symptoms as well. And as far as intestinal symptoms, this can come in the form of constipation, diarrhea, and then inflammatory or autoimmune conditions of the bowel, including Crohn's disease and ulcerative colitis. These patients are often very bloated. They complain of abdominal pain, and this pain can be throughout the abdomen. And then again, food sensitivities that we may see. And you know, the next is the adrenal glands. This is another big one that we need to recognize, because this effect really causes a profound fatigue. Just, you know, can't even get through your day anymore. Start to lose your ability to function in your day-to-day activities. It's not infrequently that I will see a middle-aged female who is trying to cope with kids and work and everything that she's got to do and keep up with everything, and she's just so fatigued, and they come and they are just looking for answers as to what may be causing this. So this is where, you know, we need to recognize and go back to the gut, and I always have to go back to the basics on these symptoms and see where I need to start to correct some of these problems. Joints are huge. We see a lot of rheumatoid arthritis, fibromyalgia. This is where you may have aches and pains all throughout the body, various muscles, various joints, and again, headaches. You know, leaky gut and what we call dysbiosis or imbalance of bacteria in the gut really can lead to weight gain. So when we start to see people with weight management issues, these are people who may be going from diet to diet, they're yo-yoing, they lose weight and then they gain it all back again. And they go from place to place trying to figure out which diet is the right diet for them. Well, you know, without understanding that this patient may have an increased permeability issue or a leaky gut, none of these diets are really going to be lasting diets. You've got to fix the gut first before you can correct that. And the syndrome X, where we see a multiple number of these coexisting conditions, obesity, diabetes, and cardiovascular disease, these can all be manifestations of a leaky gut. So I would encourage anybody who may be either having these symptoms or know somebody who's having all of these symptoms, we need to be talking to our physicians about looking deeper and understanding where the issues may be coming from, and could it be an increased intestinal permeability. So here may be some pictures that are easily recognizable. You may very well be able to relate to some of these things. So I often see, again, patients with bloating, headaches, fatigue, sinuses, colds, frequent coughs, colds, and then various food allergies to the point where they just feel like there's nothing left for them to eat. So we've talked a little bit about the various conditions that can be related to leaky gut, including diabetes, arthritis, inflammatory bowel conditions, which can come in the form of Crohn's or ulcerative colitis, gastric ulcers, stomach ulcers. This is where you start to affect the lining of the stomach to the point of creating ulceration. Celiac disease, this is a huge one because we're increasingly seeing celiac disease in the population. And this is where you have a molecule called gluten, which creates a lot of inflammation in the gut. And this inflammation continues to create loss of the absorption capabilities of the intestines, and again leads to vitamin deficiencies, in turn manifesting as anemia, fatigue, etc., and skin conditions associated with that as well. Irritable bowel syndrome. So irritable bowel syndrome is sort of this basket term that we might use when we really don't have any other good explanation for symptoms. And this can, in irritable bowel, we can see various symptoms, including bloating, diarrhea, constipation, abdominal pain. And when I see patients with these symptoms that I might have termed irritable bowel syndrome many years ago, I now know that I need to look at intestinal permeability, what's causing it, what kind of bacteria are in the intestines, are there other stressors that may be creating some of this inflammation, is there dysbiosis or bacterial overgrowth issues in this particular individual. We know that cancer can really take a toll on the intestinal tract, and the treatments that are associated with cancer even more so. We know that all of these can be very harsh on the intestines, rearranging the bacteria in our intestines and creating an increased intestinal permeability. Asthma can be, again, a manifestation of a leaky gut. Allergies, as we've talked about, autism. You know, when I see and hear about children with autism, I think we need to, again, go back to, is there an underlying reason for it? Is there something that we can correct in the intestines and really have a significant impact on the autism and their cognitive functioning and capability in the future of assimilating back into society in a more easy way? Infections, respiratory infections, intestinal infections, all of these take a toll on our intestines and increase the tendency for a leaky gut or increased gut permeability. Now, you know, we've talked a lot about what all we can see, the symptoms and the effects of having a leaky gut, but how can we really look for a leaky gut? How do we make this diagnosis? And you know, the diagnosis isn't always easy. First, of course, we have to think about this as a possible diagnosis. And then we've got some tools that we might be able to use in order to help us. There are some blood tests that might be useful to us. So I mentioned briefly a protein called zonulin, and zonulin is the protein that really binds the cells together. And when we're looking at a blood test for this, we can see sometimes an increased zonulin, which gives us a clue that there may be a leaky gut issue going on. Stool testing, and so I actually use quite a bit of stool testing in my practice to be able to identify some of these key factors And I found it incredibly useful in making or identifying what may be going wrong in the gut and how I might be able to approach correcting this issue. So there are very sophisticated stool testing that can actually give us an idea of bacterial imbalances, digestive enzyme deficiencies, which may be leading to increased intestinal permeability, and inflammation also that may be leading to that. We can also use some urinary testing. There's testing that we can do to look at organic acids that give us clues about intestinal permeability. And then food allergy testing. Food allergy testing can be a little bit tricky. It's not a perfect test for us to be really relying on because there's so much variability in the testing process. So I do use it and I find it helpful in certain situations, but these are things that really are available to us. And, you know, as much as I still have a very strong background in allopathic medicine, these tests have really come to me through my training in functional medicine. And I feel like I just have a much larger toolbox that I can offer to my patients to be able to identify and correct these issues. So now let's talk about what we can do to heal a leaky gut, because this is really where the exciting information is. And in order to really do justice and heal a leaky gut, you really have to look at what is irritating and damaging the intestinal tract. This is where I have to go back and look at what's in the diet. What are they eating? What's for breakfast? What's for lunch? What's for dinner? And I have to dissect this information sometimes, because sometimes you don't even realize what you're eating and how it's affecting you. You're just so used to it. And we're so used to our comfort foods that we've eaten since childhood that we don't really think that these are damaging our intestines. But you know, now we understand that it's the processed foods, it's the sugars, it's the sodas, it's the high fructose corn syrup in our diet. And then it's the pesticides that are being used on our foods that we're ingesting and then creating some of this damage. So really a deep dive into diet can really be helpful in correcting and identifying and correcting some of these issues. So that's really the first place that I start. And oftentimes, we'll have to put patients on what we call an elimination diet. And this is where we, again, go through a process of really taking out all of the potential foods that are creating these disruption of the intestinal barrier. We eliminate all of this and we really start with a clean slate. And really in a good elimination diet, the first phase of that really takes about 6 weeks. So it's very important that we explain to patients that this process of correcting a leaky gut is not an easy process, and it doesn't happen overnight, because really we didn't get here overnight. It took years and years of eating the wrong things and being exposed to different things that really created this process in the first place. So it takes time to repair, and we require a lot of buy-in, because a lot of the burden of being able to correct this process, you know, I can tell patients what to do, but the patients have to have the ownership of taking that information and really applying it to their lives. And, you know, I have some people who will say, look, I am not going to do all that. I'm not going to eliminate all these foods. I can't do it. But when I explain to them how important this process is and how much better they can feel once it's done, you know, oftentimes I can get people to go through this process. And I'll tell you that I have some patients who are really good. They just adhere to everything we tell them to do. And although, again, it doesn't happen overnight, within about 3 months, they really can see the benefit to having done this. And I have patients who tell me they haven't felt this well since they can ever remember. And so the gratification that we get from being able to hear that from people is so important. And I can tell you that the functional medicine training that I have received has really allowed me to have that impact and understand the importance of food in our healing process. After we've identified all the irritants and removed them, then we need to allow for replacing. We have to replace the things that we have taken out of the diet with healing foods. And again, this is a learning process, and we need to educate our patients on how important it is to change our behaviors and change the sometimes giving up food really has a psychological impact. And we need to talk our patients through that. We need to stress the importance of why we're doing this. And really, there's so many foods out there. When I start to tell patients you can't eat this and you can't eat that, they feel like, oh my gosh, there's nothing left for me to eat. What do you want me to eat? And we need to educate them and introduce them to foods that they may not be used to eating, but there are plenty of food options, really healthy food options that we can start to introduce. And, we have diet plans for those people who need them. We can meal plan with them for those people who can look at a sheet of paper and see that these are the foods that you should be eating. We say, good, go for it. Take this and run and make it work. And it's great to see them do that. So really, we can meet the patient where they're at and take them through this process. Reinoculation. So this is where we want to put good bacteria back into the intestines. We want to do this in the form of probiotics. Sometimes we do need to use probiotic formulas. And we have a variety of really good probiotics that are available to us now. And eventually what we want to do is use prebiotics, or these are foods that will promote good bacterial growth. So although, again, we may use probiotics for a period of time, once we've taught people how to eat right and how to put good food back into your diet, we'll give you the tools to have the prebiotic foods that can really sustain good bacterial growth in the intestines. And then repair. We talked about how we have intestinal permeability and the cells that get disrupted, and you get leakiness of the lining of the intestines. Now we need to repair that process. So once we've done all of the above, we can now go through a process of redeveloping these strong bonds between the cells and decrease the permeability of the intestinal tract. And this is where we may use some nutrients. There are a variety of nutrients that are available to us in the form of supplements. And again, the repair process takes time, generally on the average of 3 to 6 months to correct. But we're so fortunate to have so many great companies that are giving us a choice on multiple nutrients that can help us perform this process of repair. There's some key nutrients that are really helpful, and I'll just throw a few out. L-glutamine is really helpful. Zinc carnosine is another one that can be helpful. And they're really great formulas that actually combine some of these so that we're not giving 10 different items. We can really combine it into just a few things that can help to repair. And then rebalancing. So how are we going to make this process really stick? How are we going to fix it and make it last for a long period of time? And this is where we have to come to rebalancing and the importance of sleep. I can't understate the importance of sleep. And sleep is really that time that it takes for us to rebalance our whole system and give our bodies the time that it needs to repair. Exercise is so important, getting out there and moving. And I don't mean, you don't have to go to the gym and perform like an athlete. You just need to get out there and move. And, even 20 to 30 minutes of walking a couple of times a week is really a great start. And for those of you who are not used to that, take it easy, just work up to it. Go out for 10 minutes a couple of times a week and just stroll and really, walking outside and just kind of taking in nature. I think we forget that we forget to look at the trees and enjoy just the the view of nature, even just in our own neighborhoods, such a useful process. And stress reduction. You know, we're on the go. We're constantly going from one task to another, juggling so many different things. We're juggling our work life and our home life and our kids, and trying to make everything work. And we forget that that we really need time for ourselves. So I would really just kind of recommend that we think about that. And, you know, I try to schedule some time where I can do something that I really enjoy doing at least a few times a week, you know, even if it's 20 to 30 minutes just for yourself. And this is where you can really just heal and improve that repair process of our intestines. So eat well, live well. Relax, take it easy, get some of the stress down in your life. I know easier said than done, but we really need to, again, understand the importance of that. So, Dr. Chari?
Thank you, Dr. Tamarisa, and here we go.
Thank you, Dr. Tamarisa, for an incredible presentation. Incredible presentation. So thank you, everyone. So thank you, everyone. So for listening to this, and Dr. Tamarisa, thank you for an incredible presentation. So if you enjoyed this, everyone, please give your likes as well as your loves in Facebook, so that you can show her your appreciation. We're giving her a thumbs up for an incredible presentation. So thank you. And now we would like to go into live Q&A. So please let us know your questions, and we'll go over as many as we can live. Okay?
Absolutely.
So here we go. Let's see.
Okay, so give me 1 second here. And one question was, how long does it take to heal a leaky gut?
Yeah, absolutely. And so, you know, as I alluded to during the presentation, this process really can take time because, as we know, you know, this is years worth of burden on the intestines that has really led to a leaky gut. So oftentimes it takes, you know, a good 3 to 6 months, sometimes even longer, to be able to repair the process. And, you know, again, I think a lot of it is how willing someone is to make the changes that we're trying to enforce. And as long as we recognize that, yes, it is going to take time and it takes patience to be able to get through this process, but you know, it can be done, and I have seen it, and I can't tell you the number of patients that have really you know, benefited from this whole process. So it's great if you can endure the 3 to 6 month time frame. You'll start to see the changes along the way, but really that really heightened sort of awareness of what this whole process means comes at about the 3 to 6 month mark. Okay,
wonderful. And would you mind giving like a case history of like a before and after with a patient who had leaky gut, and what their experience was and how you approach it?
Absolutely, absolutely. And so, you know, in my practice, I deal with a variety of conditions that are affecting the intestinal permeability or the gut barrier. And so, you know, my most common scenario, at least now, is bacterial overgrowth. So this is what we call small intestinal bacterial overgrowth. This is often a person that is presenting with bloating, abdominal pain, diarrhea, constipation, maybe sometimes going back and forth between these symptoms, and fatigue. You know, they really are starting to get tired of feeling the way they're feeling, and they can't, you know, even maintain their day-to-day activities. So this is somebody that, again, we, you know, go through a dietary intake, and then looking for what we call dysbiosis or imbalance of bacteria in the intestines. And once we've identified that, oftentimes, again, we'll start on an elimination diet. This is where we're taking a lot of the toxins out. We're correcting the bacterial imbalances that may exist. We're treating bacterial overgrowth. Sometimes we do use a combination of botanicals that can help with bacterial overgrowth, along with, sometimes I do use antibiotics, certain ones, very specific ones in this setting. And once we've corrected that, then we are looking at, again, a maintenance of some dietary modification and restrictions. And somewhere about 8 weeks or so after we've implemented this, then we're starting to loosen some of these restrictions and add things back into the diet. And I'll tell you that really, where I start to see improvements is somewhere even in that 6-week time frame. The first 6 weeks, I can see reduction in gas and bloating, increased energy levels. Once we've taken all the processed foods and sugars and all the quote unquote garbage out of our diet, we really see so much of energy that comes back, and we're seeing these people really kind of get back, and they are seeing the value of it, and they're willing to continue doing some of the things that we're asking them to do at this point because they feel so much better. And I have patients, countless number, who say they haven't felt this well in 20 years sometimes. They're dealing with this for such a long time before they realize that there is somebody out there who can help with these conditions. And it's great. Yeah.
Beautiful. Thank you. Thank you. Well, again, your patients are so blessed. Houston, Texas is very blessed to have you there. And for those of you who may just be joining us now, we have a very special guest, Dr. Radha Tamarisa, who is board certified in gastroenterology. And she just gave us an incredible presentation on what is leaky gut and 5 tips to help you heal a leaky gut, because this is such a critical topic, such an important topic. I think leaky gut is an epidemic. Do you feel the same way with what you're seeing in your practice?
Absolutely, absolutely. The leaky gut, again, is a manifestation of so many other things that are going on, right? So it's the autoimmune disease, and it's the fatigue and the adrenal, fatigue, and the thyroid disorders. So we're seeing, all of these things are affecting the intestinal permeability. So absolutely, we see it so much, and so much more than we should be seeing it if we were to address some of these issues really early on. So
absolutely, absolutely. And so for those of you, again, who are just joining us, please feel free to send us questions. We're doing a live Q&A with Dr. Tamarisa. So some other questions that came up here was from Sita Marabushi, and she's asking, can you suggest good probiotics or a good brand?
Absolutely. And again, there are so many good probiotics out there that, telling you just one brand really doesn't do justice. But, what I look for in a good probiotic is really that it's a medical grade product, that it's something that has been tested well and is reliable. Again, there's so many probiotics out there, and sometimes, but the packaging is important, how they're preserved is important. And so if you don't look at all of these things, you're going to end up with supplements or probiotics that really aren't going to do you any good. So, you might as well not take them. If you're going to take them, they really need to be good. And I look for multiple strains. So I like to have a number of different bacterial strains when I'm choosing a probiotic. Oftentimes, I'll choose a refrigerated probiotic because I do think that that's something that's going to be more likely to survive in the intestines and really provide the benefit. But I'll tell you, even our probiotic manufacturers have become very sophisticated, and they're able to allow for good preservation of bacteria in these supplements. And so I'd be happy to connect with you. If you'd like really specific recommendations, please let me know.
Beautiful. And another question is this an acquired disorder? Let me see, I just lost. Is this an acquired disorder and no congenital side, or is there any familial transmission?
Oh, that's a tough one. That's a tricky question. So this is not a this is not a familial disorder per se. This is really something that happens as we go through life, but this can happen at the time of birth, and it can even happen before birth, because what's happening in the mother as she's carrying the child can change the way the microbiome or the bacteria in the infant come out. And the birthing process is so important to creating good bacteria. Sometimes, unfortunately, we have babies who are delivered by C-section, and in that process, you really don't get the benefit of the mother's flora in the intestine. And so we can see that babies who are born through C-section sometimes have more in the way of autoimmune issues and allergy issues as they get older. This becomes more and more apparent to us. So having that really good microbiome at birth is so important. And, now we recognize the process of birthing as being such an important way to transmit these bacteria to the infant. And so, no, it's not familial, but can it be congenital in the sense that it is starting so early in life? Yeah, it really does start as early as birth. So, again, recognizing that these may be some key factors in not having good microbiome at birth may be something that we recognize and be proactive in this case about correcting that issue early on.
Okay, wonderful. Thank you. Another question is, any thoughts on leaky gut connection to acute coronary syndrome, since leaky gut seems to lead to increased systemic inflammation, which may lead to plaque rupture?
Yeah, absolutely. And, I don't know that we have exact studies to be able to definitively talk about the plaque rupture process, but definitely the systemic inflammation. The leaky gut and the fact that toxins can now enter the circulation and mount these immune responses. There really is no doubt in my mind that there is a correlation between leaky gut and increased cardiovascular disease. As far as, does that ultimate plaque rupture have to do with dysbiosis? I don't know that I have the studies to support exactly that phenomenon, but it most definitely will contribute to poor cardiovascular health.
Excellent, excellent. And it's fascinating how more and more they're talking about how the gut microbiome affects our heart health.
Absolutely.
Yeah.
So we've known for years that the bacteria in our mouth really, if we have poor bacterial hygiene, poor oral hygiene, that we have an increased risk of cardiovascular events, right? That's something that we identified and have known for a really long time.
Absolutely. Absolutely. And you're getting comments that, thank you so much. We will definitely contact you, Dr. Tamarisa, and that you seem to be such a caring and so helpful for your patients. So you come across, it comes across, your heart comes across as well as your brilliance. And let's see. Okay, another question is, what supplements may be helpful to replace lost nutrients?
Yeah, so, a really big nutrient that I didn't mention is going to be vitamin D. And vitamin D is so important to our immune systems. And it's such a common deficiency for us to see. And we know that low vitamin D levels really correlate with higher inflammatory conditions. So especially in my inflammatory bowel disease patients, Crohn's, ulcerative colitis, I always check vitamin D and I always try to correct it. And a good vitamin D level is going to fall somewhere in the range of 70 to 90. And some people have even said higher than that. in order to really give the immune system as much competency as it needs. So vitamin D correction is super important. I also will look at B vitamins, because B vitamins can also be really a problem in terms of deficiencies. You know, B vitamins may be deficient because diets are insufficient in vitamin B. Sometimes absorption of vitamin B, because of our gut issues, whether it's inflammation or leaky gut or dysbiosis, where there's poor bacterial imbalances, we can see vitamin B deficiencies from that too. So that's something that I look for quite often. You know, beyond vitamins, there are certain minerals and amino acids that are really important to the integrity of the gut and the strength of the gut. And so I mentioned L-glutamine, for example, which is one of those very important amino acids for gut repair. And, you know, I could probably think of 10 different things that I would like to put patients on, but I really try my best to streamline the process and put people on as few supplements as possible, but make those supplements really valuable. So, you know, there may be one thing that has a lot of different ingredients that help with gut issues. So I do try my best to not overload people with a ton of supplements either. And really, you know, there's no supplement that's going to cover a bad diet. So use food as medicine, and that's really going to do you well.
Fantastic, fantastic. Well, it seems that we've covered all of our major questions here. We're going to have you come back again for sure. And without a doubt, you have a wealth of information and expertise, and we'd love for our viewers to be able to benefit really from your wisdom and your experience.
Yeah.
So thank you very much. That was excellent. And thank you all for your incredible questions. This was really helpful. And for those of you who watch, you know, the replay as well, you're going to really be able to benefit from this. And be sure, everyone, to please share this video with your friends, with your family. They're going to definitely benefit from this information. So thank you.
I want to thank you for the opportunity for me to be here and present with you guys. It's such an honor to be with you. Dr. Chari, you've been doing this for so many years, and you've been an invaluable resource to your community. And I can't tell you that really, you know, some of the inspiration for what I have searched for and kind of looked for in terms of medical treatments has really come from knowing you and what you do, Dr. Chari. And I can't tell you that you've actually been such a great influence on me to want to know more and want to learn more about functional medicine. So thank you for inspiring me to do what I do.
Oh, thank you. Thank you so much.
Thank you. And thank you, Dr. Tamarisa, for a fantastic presentation. Everybody share your likes and loves in this Facebook with us today. Thank you so much. So now I'd like to put Dr. Tamarisa's information on the screen in case you'd like to contact her. So here it is. You can call her at 281-869-3009. That's 281-869-3009. Her address is 25230 Kingsland Boulevard, Suite 102, Katy, Texas 77494. Or you can reach her on social media at www.facebook.com/Katy Integrative Gastro, or her Twitter, which is Katy Integrative Gastro. And thank you all for joining us here today. And please join us in our virtual community clinics by texting VClinic to 888-111, VClinic to 888-111 for our presentation tomorrow morning at 10 a.m. Pacific time, with live Q&A as well with their Chari Center Community Clinic. And please be sure to join us next week for our next episode of Chari Center Health Hour, next Friday at 5 p.m. Pacific time. So thank you so much for coming here today. And we will see you again next time.
Thank you. Thank you all for coming, and thank you again, Dr. Tamarisa, and we'll be in touch.
Thank you.
Absolutely.